Welcome to video 4, Personal Care and Hygiene Assistance. And in this lesson, we're going to talk about assisting with bathing and dressing and grooming and toileting. We're also going to talk about maintaining client dignity and comfort. We're also going to talk about recognizing and addressing hygiene-related health concerns. So with that, let's go ahead and get started. So providing personal care is one of the most important responsibilities of a caregiver. And along with providing hygiene, please focus on helping clients feel comfortable, respected, and dignified in their everyday lives. In this lesson, we'll go over how to properly assist with personal care tasks while maintaining a client's independence and self-worth. So let's talk about assisting with bathing, dressing, grooming, and toileting. You see, many seniors need help with daily hygiene tasks, but every person has a different comfort level and they have a different ability. Your role as a caregiver is to assist where needed while encouraging independence whenever possible. So, as it relates to bathing assistance, it's important to offer client choices, because some may prefer a bath over a shower. And so regardless of what they prefer, make sure you ensure the water temperature is warm but not too hot. And use a shower chair or grab bar safely if they have one. Make sure that you never leave a client unattended, especially if they're unsteady. Now let's discuss dressing and grooming. As it relates to that, let the client choose their outfit if possible. Assist with buttons, zippers, or socks if needed, and make sure you brush or style their hair in the way they prefer. Now, you also want to ensure dentures and glasses and hearing aids are properly placed. Now let's talk about toileting assistance. Make sure, as it relates to that you always respect their privacy. Make sure you knock on the door before entering the bathroom, and assist with hygiene after toileting if necessary. Now, you want to check for any signs of infection, irritation, or skin breakdown. And obviously, you definitely want to wash your hands before and after assisting. So let's talk about maintaining client dignity and comfort. So imagine needing help with something as personal as bathing or using the bathroom. I'm sure you can imagine that it can feel quite embarrassing, but the way you approach care can make all the difference. So here's some ways to maintain dignity for our clients. Use a towel or a robe for coverage while assisting with bathing. Make sure that you speak in a calm, reassuring tone, and then offer choices whenever possible. And make sure that you're patient and you move at the client's pace instead of at your pace, because sometimes they may move a little bit slower. So in this situation, we're going to talk about a real life scenario. We're going to call this person Mr. Andrews. And Mr. Andrews always started his day with a fresh shave and a splash of aftershave because he likes to smell good. But over time, when arthritis made it hard for him to hold a razor, he stopped shaving altogether. And the thing is that, he felt embarrassed about his appearance, but he didn't want to ask for help. So his caregiver, we'll call him Daniel, he noticed this and he offered to assist. So instead of taking over, Daniel handed him an electric razor and he guided his hand gently. And because of that, Mr. Andrews felt proud that he could still do it by himself, right? And he just needed a little support. So you see, in this situation, it's the small things like letting someone shave for themselves that can make a difference. It can make a really big impact in their confidence and their self-esteem. So let's talk about recognizing and addressing hygiene-related concerns. You see, good hygiene isn't just about looking clean. It's really more about preventing infections and health issues. And as a caregiver, you should watch for early signs of problems before they become serious. So, what are some things you should watch for? 1, unusual body odor. Those things could indicate an infection, or it could also indicate dehydration, which is a problem. Make sure that you are paying attention and looking for red or irritated skin, because maybe there's pressure sores or rashes. Make sure you're also looking for changes in hair, nails, or skin color. Also, be sure to look for signs of urinary tract infection. So if they go to the restroom, if they're having pain, make sure you ask them, hey, I noticed that you're having pain. Was there by any chance any cloud in your urine? Did it look no different than usual? And if they respond, then make sure that you react accordingly. Okay, let's talk about another real life scenario. We're going to call her Miss Lewis, and in this situation, she has a skin infection. So Miss Lewis loved her independence, but arthritis made it hard for her to dry off completely after her showers. So over time, moisture would build up under her underarms and the skin folds. And what happened is over time that led to a rash. So her caregiver, let's call her Maria, noticed the redness and gently patted Mrs. Lewis's skin dry after each bath. Maria also suggested a mild powder to keep the area dry. And so what happened is within a week, the rash cleared up, and what it did is it prevented a more serious infection. You see, by paying attention to small details, you can help prevent bigger health issues. So never ignore the small changes in your client's hygiene or comfort. So as we wrap up, I really want to reemphasize that personal care is more than just a check mark on a long list of your responsibilities. It's really an opportunity to help someone feel comfortable and respected in their own skin. You see, the way you assist can build trust, it can preserve dignity, and it also can improve the overall health and well-being. So I want to say thank you again for watching this video, and I hope you took great notes for the quiz that's coming up. And with that being said, I will see you on the next video.